The Skisntructors tip of the week. When introducing a new advanced active ingredient, don't just talk about the science, anchor it in results your clients care about. Instead of leading with biomimetic exosome retinol, start with this is the first retinoid that boosts hydration while smoothing fine lines without irritation, even for sensitive skin. Translate the clinical into client language and adoption will follow.
Welcome back to the Skisntructors. I'm Jolie.
And I'm Morgan. Our tip of the week is a hint to what we have in store today.
Yep, that's right, Morgan. Today, we're thrilled to have Keith O'Brien, CEO and founder of Hydrinity Skin Science, with us today. Keith has been leading the charge in regenerative skincare, and today he's sharing insights about Hydrinity's groundbreaking launch, RetaXome. This is a daily retinal hydrator, and it's the first biomimetic exosome encapsulated retinol designed to deliver clinical level anti-aging results with virtually no irritation.
Welcome to the show, Keith. We're happy to have you joining us today. And for our listeners with no background with Hydrinity, can you tell us a little bit about yourself and your role at Hydrinity?
Absolutely, and so thank you, ladies. It's my pleasure, but we probably don't need you. Your tip of the day was so good, we may not even need to talk about it. So it was awesome.
Perfect.
No, thank you. I'm really excited to. We just launched RetaXome last week, but before that, I'll give you a little background on Hydrinity. We were founded in 2022. We're three years old, but we've been very fortunate. The aesthetics community's really embraced us, our products, our science, our approach, and so we're lucky. The last 2 years in a row, named the fastest growing professional skincare brand by the Klein Report last year. So we feel honored. All of our products up to this one, or the majority of them, were rooted in our core technology of hyaluronic acid. We found a different way to deliver HA. I joke all the time, and you probably heard this before if you've heard me speak, is I have this huge man crush on HA. I think it's underutilized, and people just use it the wrong way. The molecular weights are wrong. It's not the ingredients; it's formulation. We say all the time at Hydrinity, and our background is regenerative medicine. That's where several of us came from when we got into the aesthetics. We just saw that some of our early products that we were developing for other usage made super compromised skin, just luminous, and it heals so quickly that we had that aha moment and said, listen, skin is skin, and some of the same things you need to worry about, collagen and elastin production, the balancing of your pH, the reduction of inflammation, would play really well in the aesthetics world. And so we brought that science and that approach over, and that's what's gotten us this far. And then this product right here is just it. People tell me this is the most innovative product in the last 10 years or so. We'll see about that, but it's really groundbreaking, and this product is truly amazing.
I can't wait to hear more about it. I saw the before and afters from the clinical, and truly transformative. It's amazing.
Yeah, absolutely.
So Keith, you've been on a few podcasts here lately. You've been busy talking about this amazing product. But we want to kick it off a little bit different. And if you weren't running Hydrinity, what do you think you'd be doing right now?
I'd be a gentleman farmer.
I love that.
I love
I
it.
would have to join you because I love.
Yes, absolutely.
I secretly think that I should have been a farmer.
Yeah, she definitely should have been.
I love that. Julie, do you have a question for Keith?
Yeah. One more that I have is, what's one skincare myth that you've heard in your career that still makes you shake your head?
Golly, there's so many.
Probably something about HA.
It was. I was going to say I have to go back, and that hyaluronic acid in certain climates is not good, and that's just not true. You just have to use them the right way. It's a hydrator. It's not a moisturizer. And that's where people sometimes they get confused.
Yeah.
Your skin needs to be hydrated, but sometimes you have to moisturize in addition to hydrate. And so I think that's one of the myths, is that all HAs are created equal. They're not. They absolutely are not created equal.
Yeah,
I
totally.
love that. Well, you've called RetaXome a new gold standard in regenerative retinoid therapy. And for those of you who may be intimidated by the science, what exactly does that mean in everyday terms?
In everyday terms, 40% of people cannot tolerate or don't do well with retinoid therapy. It is the number one, it's the only one that the FDA recognizes a true anti-aging fine lines and wrinkles. Right behind SPF, it's probably the most important thing that you can do for your skin on a daily basis. SPF, there's no doubt about that. But when you use retinoid therapy and you start stimulating and you get cellular turnover, it's going to give you healthy skin. The problem is, if you've had rosacea in the past, if you were FITS 1 or 2, you had a hard time tolerating those. And so when we say true regenerative medicine, we've built this in a way to give you the most potent Retinal with an A and not an O. It's the most potent non-prescriptive product, but it also has the least side effects if you look at the data. And you can start from day one. You don't have to be good at math. Oh, do you have to remember, did I take this yesterday, today? No, it's every night, and you start, and it's daily. And that's the best thing because people ask me all the time, what's the best skincare regimen? The one that you can do every day. Just be consistent.
Yeah.
And so
I
agree.
what it does, it allows you, it gives you the ability to people to use this product that haven't been able to use one in the past.
I
Yeah.
love
It's
that.
that simple.
We're really big on the ABCs of skincare, so vitamin A being A. And I love that you're able to jump right into this and start using it day one and continue every single night. I love that.
Yeah, I'm excited about it. Clinical trials showed a 44% increase in hydration within 2 weeks with 0 adverse events across 55 patients. Can you share one story or moment from the trials that really stuck with you?
Yeah, there was a lot that besides the hydration, we knew, because we put our HA into this, and again, it's about formulation. But we knew by encapsulating it in an exosome, getting it to the dermal layer, you were going to relieve yourself of a lot of those irritations. The thing that stuck out most to me was the erythema, the redness, at 68% reduction. Most retinoid products cause redness, cause erythema. This had a 68% reduction in that. That was the thing that stood out to me. I did not expect that. I knew it would work really good, but I didn't know how good it would be. And again, that opens it up for patients with rosacea that haven't been able to use one now. And there's a lot of those patients and clients out there. So that was probably the thing that really stood out. All the other results were really good. That was the one that I just didn't expect.
I love that.
I think that relating to that before and after photo I saw, the hydration, the redness reduction, it was wild. So I really haven't seen anything like that.
Yeah. And the thing about all these were done with a Visia machine. They were third party. They did the results and they came back to us. So it's not, the pictures that you saw are untouched. It is clinical data. This was an IRB approved institutional review board. So this was a study done the right way.
I love
it. Great.
Well, as you've expanded, you didn't just focus on that retinol or retinal. You added in your HA and other ingredients. And tell me a little bit about why you felt like that full ecosystem was so important in that one product.
It's the HA. We put an adaptic mushroom in there, ectoken, ceramides, squalene, which is one of my favorite, or squalene, depending how you say it, on what day it is. because it's not just one, it is not ingredients, it's the formulation. And when you make something, you need to get the clinical results, but you also need to get the form, fit, and function. People need to be able to tolerate it. They should want to do it. Retinols, whether you're with an O, with an A, or an RX, they all cause redness and inflammation, and people just stop using them because they start flaking off, and and you can't tell people to power through things anymore. It's really, really hard.
They don't want to do it.
Yeah,
They don't
they
want to
don't.
do
wanna
it.
do
They,
it.
they don't want to look like a lobster for 2 or 3 weeks, and they just don't. I mean, sometimes you have to, if you're dealing with a horrific melasma or something like that, but that's okay. You sign up for that. So you have to get results fast, and that's part of why we built it the way we did, to get the good results, but without the side effects, and get results fast. And that's the other thing that Hydrinity is pretty well known for, is how quickly you can start to see the results.
I agree with that. I just got the Hyacin, right? That's
Yeah.
the spray. Amazing.
Yes.
Love it.
I
I had
know.
a little bit of folliculitis from a laser treatment, and
Yes.
within days it was clear. It was
Yeah.
great.
Yeah, it was.
Yeah.
It cleared it right up. I was shocked.
Yeah.
Yep. So don't be surprised with the Hydrinity stuff. No more shocks.
Yeah, I love it. So, Hydrinity has taken something that was once clinical and almost experimental, exosomes, and made it consumer friendly. What cultural barriers have you noticed in getting people to trust biotech in skincare?
I think there's been a lot of promise of regenerative medicine in aesthetics, and nobody's really been able to deliver it. So that's the reason we took our time with this. This has been a labor of love for over 2 years to get it just right. We chose the biomimetic exosome versus a human exosome or some derivative of that, because with the biomimetic, it's very precise, it's pure, and you know exactly what's in it. The only things in it is what you put in it. The other thing is, with it being an exosome, even a biomimetic, your body doesn't see it as a foreign object. And so you don't get the M2 macrophages, they don't attack it. And so you're able to get it down to the dermal level. It's just, there's so many advantages. And I think when you take the time and you explain it to people what it is, it's a delivery mechanism. It carries it to where it's supposed to be. We all know the two troubles with vitamin A's are they're super unstable and they give you a lot of side effects. And so that was our thing, is we know it's good. There's vitamin A is fantastic. How do you get rid of the two troublesome parts? And that's what we worked on for 2 years, is how to get rid of that.
Do you think that exosomes are going to become as common as HA in the marketplace?
I don't think they'll become it as common, because they're pretty sophisticated. They're hard to do, and they're hard to do the right way. There are multiple uses for them. I'm a fan, as you know, and the thing is, in aesthetics, exosome is great. There are tons very not clinical, thousands of studies going on right now using exosomes for medical, in medical applications. Drug delivery is one for sure. It's good. I think also, a lot of people have trouble with their gut, so digesting things. But if you can use a topical, a transdermal delivery system, that's an alternative way to treat a lot of different things. And so I think you will absolutely see, you'll see more and more. I think the aesthetics industry in the next 10 years is really, even at 5 years, is poised to get some products that they didn't think they could get before. I believe there's some people out there doing some really good work.
I totally agree with that. Yeah.
We were just at the Science of Skin Summit in Austin, and every year that we go, we learn something. We learn lots of things.
Yeah.
Just, it's fascinating how quickly things have changed even in the last year. It's amazing.
No, that's
Yeah.
that's one of my favorite meetings. Ted
Yeah.
and Patty do a great job there.
They're
It
great.
Amazing.
If you want to go and be cool and nerd out, that's the one. It's really
Yeah.
Right.
It's a great
Absolutely.
meeting,
I
yeah.
agree.
We usually end up in our hotel room eating some
Cheeseburgers.
cheeseburgers and just
Yes.
decompressing because our brains have about to
Yeah.
explode. But it's our favorite meeting. every single
Definitely.
year.
Yeah, it's incredible. And this year was, the best that we've been at yet. So you've led Hydrinity with a very science-driven lens, but as CEO, you also have to inspire a team and a culture. What leadership lessons have you carried from your pharma background into skincare?
I think the thing is, we always say here at the company, do what's right for our partners, do what's right for the patient. And if you do that and you have good products, everything else takes care of itself. When we started, and we're still that way, we don't have minimum orders. You don't have to carry the entire line. It's not fair for me to come into your practice and say, I need you to carry everything we have. You may be really happy with one or two products, and you may only need two or three. So I just think by doing that, I don't know if that's a pharma background. That's just doing business the right way. It's just being true partners, and we really do. Our thing is we want to deliver first-class customer service in everything that we do. And I think you do that. That's the reason we didn't do minimum orders. We didn't do, you have to carry the entire line, which would have been easy when we started. We only had 3, but now it's not so easy. We got a lot more now. I just think doing things the right way. We guarantee our products. If you don't like it, if you have a client that use it, and what we say is use the whole bottle. If you use it, and if you don't like it, if you bring it back, we refund you, no questions asked. It's just doing things the right way.
Yeah.
Oh, I appreciate that.
So looking ahead 5 years, where do you see Hydrinity's role in regenerative skincare?
I hope we're on the cutting edge in 5 years like we are now. That is one of our things. We want to make sure that we keep pushing the science and the innovation and doing more and just creating great products that people want to use. I mean, we do have this standard. I mean, we've been fortunate, all the products that we brought out in the last 36 months, but we've also had 4 that we said no to because we didn't think they were good enough. And so we just want to keep pushing clinical data, clinical science. Let's back this up with facts, and let's make it an experience. We really do believe, not just now, but moving forward, you can have both science and luxury. And I think when you get to that intersection, when you get both of those together, that's when you build something really special. Those when products are really good.
Yeah. And I think at this point, just consumers, that's what they are demanding. And
Yes.
I love to see you guys getting there. Yeah.
Yeah, absolutely. Okay, so if you had to describe RetaXome using a metaphor outside of skincare, like let's say like a car or gadget or even like a superhero, what would it be and why?
Wow. So I think RetaXome is like it's like a taxi in a big city, and all the different tall buildings are your cells, and what the exosome is the taxi, and it drives up to the building, and there's an envelope for delivery. You take the envelope, that's the retinol, you take it inside the building and deliver it, and then there's a message in there, and that's what it is retinol. It's your vitamin A that gets delivered in the envelope through the taxi, through the courier service to where it needs to go. That's off. That's kind of because what you got to get is you have to get it to the right place, but you have to protect it. So if it's raining, the exosome, what it really does is protects that vitamin A, and so you're protecting what's inside that envelope, so you can get it exactly where it needs to be.
That was perfect. Yeah, I love that.
Well, Keith, when you're not breaking down complex science and making fun analogies, what would you say is one interest or hobby that keeps you grounded?
Wow. I guess I say, I don't know. I work all the time for the most part, but no,
Same. Yeah, we understand.
there's not a lot of time to do other things. But I love to, when I said a gentleman farmer, I'm in it. I love to drive my tractor. It's
I love
it's
that.
it's a
Oh,
place
yeah.
where I can be at peace.
Oh, I
Yeah.
love that.
I love it.
That's great.
Awesome.
Well, this has really been incredible, Keith. And we nailed it. I mean,
Yeah.
you were so great to talk to, and I really appreciate hearing more about the new product. And do you guys have like a find a provider website that
Yeah, no.
people can hop on?
Yep, go on the website hydrinity.com. You can find a provider, absolutely. And we encourage that. If you don't have a provider, you can buy it directly on the website. But I do highly encourage people to go see their professional, because you don't want to misdiagnose yourself, and sometimes they can give you insight. And because I know there people believe if you see it on the internet, it's true. Well, maybe it is, maybe it's not. But there are trained professionals out there that can get you to where you need to be a lot quicker and save you a lot of money for you trying stuff
Yeah.
that just doesn't work. And
Yeah,
so,
I agree.
yeah, our new website will be probably live in about 2 weeks also. And I saw a preview last week. It is so good. Ours works really good right now, but the one that's coming up has a lot more science. You're able to pull a lot more things. You can download things, and you can go down any rabbit hole you want to go down. It's going to be really
Cool.
really good.
Yeah. Well, we
Yeah.
like
That's
to
awesome.
nerd out, and
Yeah.
our
Totally.
that's our hobby, our
Yeah,
Yeah.
truly. Is nerd not to skincare.
Yes, yeah.
Awesome.
Keith, was there anything that you wanted to cover today that we didn't ask you about?
I don't think so. You ladies were lovely. I enjoyed it. Thank you for letting me come on and talk about RetaXome, because I really do think it's a novel product, not just in that it's a true regenerative medicine. It's delivering on that
Yeah.
promise, but it's the one and only encapsulated in an exosome. And that all that means is it's going to get to the dermal layer, and true skin health only happens at the dermal layer. It's you have to get there, because that's where all the magic happens with fibroblasts, keratinocytes, collagen, and elastin production. You have to get it there. And with RetaXome, it's hydrating. I mean, there's no other one out there in this category that is. And the reduction of redness, that is just has never really been seen before. And I think this is a product that everyone can use. That's, you get those 40% of people who are scared or have tried one in the past and hasn't, or just have been told they can't. Now you have something that you're able to use for sure.
That's great.
Yeah,
Well, we are definitely looking forward to using it and trying it, and
I know.
I'm excited.
I can't wait. I'm excited.
Yeah, perfect.
Awesome. Well, this was awesome. Thank you so much again, Keith. It's not every day that we get to talk about a breakthrough that bridges regenerative medicine and everyday skincare. So thank you so much.
No, it's my pleasure. Thank you, ladies. I appreciate it. Thank you.
Well, as always, thank you so much, everyone, for joining into the Skisntructors. If you love this episode, make sure you subscribe, leave us a review, and share it with a fellow skin pro. We'd appreciate those insights.
Yep. And don't forget to follow us on Instagram at the Skisntructors for more tips and behind the scenes and upcoming guests. And don't forget to check out Hydrinity Skincare online or on Instagram.
Absolutely. And don't ever, ever, ever hesitate to educate.